I brought Ivy into my family about 6 years ago. We first moved out, my husband and I first moved out on our own, and we didn't want the responsibility of a dog, so we adopted a cat, and here we are. Ivy was 9 months old when I first got her. She is my first cat. I've never had a cat before. I've always had dogs growing up, and now I have a cat. I got her at my old clinic. When I first worked there, she was surrendered as a stray. She was in dystocia, meaning that she wasn't able to give birth, so they had to do an emergency C-section, but because she was a stray, the people that brought her in didn't want to pay for it, so the doctor took her under her care, did the surgery, and then I ended up adopting her. Ivy is my best friend. She's the happiest little cat I've ever seen in my life. She picks me up when I'm down. She's funny, she's entertaining, she's always doing something goofy around the house. She's just my support animal for sure. Ivy likes to watch birds. She likes to watch TV. She likes to play with her sister, and she's always bullying her and playing with her and putting her in the corners and chasing her around the house. She loves to cuddle. Big cuddler. If you walk into my house, she's gonna cuddle. She usually sleeps on our bed at the edge of our feet, and sometimes she tumbles off because we accidentally push her off, unfortunately. But one night she fell off and I just heard like tumbling and tussing, and it was about 4 o'clock in the morning. We got up and then we saw her, and then we saw her having a seizure. At that moment, my husband didn't know what it was because obviously he's never seen anything like that. But working in this field, I instantly knew it was a seizure. First thing I did was grab my phone so I can record it, so I can show the doctors like, hey, this is what's going on. And then I brought her here to SEVN, did an MRI. The seizure was about 35 seconds, more or less. She was a bit disoriented. She was foaming at the mouth. She seemed to be very, I would say, like agitated. She was kind of just pacing around. She didn't seem normal. But it took about maybe 10 minutes for her to come out of that. Because I knew it was a seizure, I knew that SEVN was the right place to bring her, and thankfully me working here, I had contacts and I was able to contact the doctors, let them know what was happening. They did a neuro exam and then obviously recommended an MRI. It was her first ever seizure, so I had the option of, hey, let's see what happens versus let's do an MRI, do additional testing. But thankfully, I actually have pet insurance, and I said, hey, let's just do it. This is what we pay for it. Let's just do the MRI. I want to know what's going on. And then we ended up doing it. Ivy was diagnosed with Lissencephaly, so it's basically a malformation in her brain, and her brain didn't develop appropriately. So meaning that normal brains have like ridges and bumps, and hers is a little bit more smoother. Thankfully, her case is not as severe. Typical symptoms are like blindness, seizures, just kind of abnormal behaviors. Thankfully, hers was mostly the seizure. Her diagnosis was scary because we didn't know what it would mean for her. It's not just an easy fix, it's something that she was born with, so it's more about managing her symptoms. Her symptom was only the seizure, so it was just figuring out what would we do then. Because she only had one seizure, medication wasn't the first option. We monitored her for about 6 months, and then she had another seizure, which 6 months apart is typically a good seizure frequency for a patient that's not on medication. So we just kind of let it be. But unfortunately, after those 6 months, then she had another seizure a week later, which was a little bit too close in time. So at that point, we ended up adding in pheno to her medications. She's doing great. In June, she's about to be a year seizure-free, thank God. It's what we were hoping for, and thankfully we haven't had to do any medication adjustments or anything like that. Just her initial dose of pheno was enough. Ivy is the same, if not more special, because we kind of understand her quirky attitude is maybe because of her diagnosis. But if anything, everybody loves her more because she is a smooth-brained kitty. Everybody at home loves her more. She's always been loved, but definitely more loved now than before. Because I worked here, I knew the level of care that our team provides and our doctors were able to provide, so I was very comfortable in leaving Ivy in their hands. I was able to see the whole procedure. I was able to be part of her procedure, which put my heart and my mind at ease. I was able to see how they took care of other people's patients, because even though usually I'm the one taking care of other people's patients, I was able to see that they truly, truly care for what they do and the pets around them. I want pet parents to know that it is very important to get pet insurance. If it wasn't for pet insurance, I don't think I would be able to afford any of her diagnostic treatments. It was a huge weight off our shoulders. It was very reassuring to know that I was able to count on pet insurance for her diagnostics, and I was able to get the treatment that she needed. And also do your research as far as what lengths you're able to go to take care of your pet. Make sure that you are their advocate, make sure that you are always there for them when they need them and when you need proper intervention for medical advice. It's important to do your research as far as your pet's symptoms and what is the right place to take them to so they can be able to assist you. It's better than ever, only because I always knew she was special because she was always very loving. She was like a dog in a cat body. But now it just explains everything, so I'm able to just appreciate her for what she is. So our bond has definitely gotten a lot closer. I think about her all the time. I'm at work and I'm like, can't wait to go home and see my cat. But yeah, we're as close as ever. She's very good with getting dressed, putting on little bandanas. She loves to go outside. My husband and I would just go on picnics to the park, and she never actually strayed away from us, thankfully. But I started to realize that she loves to be outside. She loves to look at the trees, she loves to look at the birds, likes to lay on the grass, eat things she shouldn't eat. But she enjoys the outdoors a lot.